Chat 200, how are you? Okay, we're marching along, and we haven't quite left the biology. Okay, we're bridging biology and psychology right now, and um, and that's a discussion of mental health and Alzheimer's disease is part of mental health, and we're focusing on that because of course that is a huge issue with respect to aging. Um, Today is October 9th, okay? And so I'll just kind of launch right into things, okay? So again, this is my view right here, okay? So if I click on this, it'll take you to student view. It takes a little while. It's going to and then it'll click in and go right into student view. Okay, so there we are. This is what you guys get to look at. Um, so if we look right here, the discussion is all about Alzheimer's disease, okay? So this is kind of a socio-economic issue right here, okay? So I want you to watch these two uh, great videos about Alzheimer's. One's about the financial impact that it has in terms of wage earning, okay? Because when you're doing the caregiving for Alzheimer's, it's not only the cost of the care, it can be $60,000 to $100,000 a year, put somebody in a facility, um, but it's also your time, okay? Your lost wages, your loss of productivity in being the caregiver, okay? And even something as simple as trying to figure out what type of facility, okay? Um, this is a really, really awesome short video about new modes of therapy to kind of ease the pain and bring back to life some aspects of the individuals that are suffering for Alzheimer's. And it's a whole area of expertise called music therapy that are used in medical centers all around the country, not just for Alzheimer's, but for lots of conditions, clinical depression, cancer, things like that. Alrighty, so that's what the discussion's all about today. Okay, so then we come back up here into the quizzes and readings. Okay, so I'm going to click on that. All right, and what day is today? Okay, so this is for October 8th. Okay, today is the 9th. All right. So we asked you to kind of look through a couple of things here. These are the facts and figures that are kind of mind-blowing. Again, I know a lot of you are business majors and study world economy. You have to wrap your head around this and what it all means. So you can go ahead and watch this video on that. Okay. We have the actual PDF file, this reading right here that you can download. Okay. So I can click on that, and with time, you see the time coursing forward over here, it'll eventually download, and there it is. So this is the actual reading that you can do about mental health concerns and aging, okay? And you can also access that via this link to the website if you wish, and then this is the website to the NIA, and we're just kind of asking you to get in there and to go around and navigate through the different aspects of Alzheimer's disease and related dementias. Alzheimer's is the most common dementia, but you can have lots of dementias. Dementias from an accumulation of strokes, maybe secondary, of course, to vascular disease, and that's secondary to diabetes. Okay, you can get dementia that can be because you're an alcoholic. Okay, that's Korsakoff syndrome. There's Pick's disease, a different form of dementia where you turn and have childlike behavior. So there's lots and lots of different ways of looking at this. And I just want you guys to kind of go through here. I'm counting on you guys being curious and treating these websites the same way you treat websites that are just your general interest. Okay. All right. So I'm going to get out of there. All righty. Just kind of, I'll send these links along for you, and then I'm going to show you a little something here. So just kind of something to kind of blow your mind here a little bit. So we're looking at some statistics right here, okay? And this is a cool website, and we start looking at by age here, and we see that Alzheimer's, the number of the percentage risk of Alzheimer's by sex, okay, and age. See, it's much, much higher for women. So there's other things that are going on for women in terms of their biology that put them at risk, okay? One way of viewing it too is maybe a lot of the men have already died off, okay? So we look here, and this all has to do with kind of trajectories and inequities, okay, that are out there. And we see that We can look at age, again, being the biggest risk factor, and it's kind of mind-blowing to look at some of these statistics. If you're, because we're pushing back the envelope, people are living to be over 85. My mom lived to be 94 years of age. And you get up there and 50% of the people, okay, have Alzheimer's disease, okay? That's a pretty scary statistic. Now we see that it varies over ethnicity, and this has a lot to do with healthcare disparities, okay? For example, treating people out here at a very young age for their diabetes and managing it is going to keep you from getting the Alzheimer's disease. You know, who has health care, who has access to health care. There's a disproportionate lack of health care for a lot of the African American populations, Hispanic populations. So all these are all things you kind of think about. All right, so that's there. This is a cool article right here, okay? And it taps into something that is talked about. This is Psychology Today, and it talks about Alzheimer's disease, but then it links it to these other issues here. And you just click on these, and it takes you to some very relevant papers. Okay, so if I click on this right here, it's going to take me to the journal from the American Medical Association, very big deal, looking at diabetes trends. Okay, so that's one issue. All right, so that's scary. Okay, and it talks about insulin resistance. Okay, and and then it gets in here, and you'll see that it talks about this right here, which is incredibly scary. Okay, staggering 80% of people with Alzheimer's disease have insulin resistance or full-blown type 2 diabetes. Okay, so diabetes is obviously the biggest risk factor along with age. Okay, all right, so I'll send you these links along with this video, and then from there, just kind of a heads up then is you're going to be able to go in here and you're going to go start preparing for this next small writing assignment, October 22nd, so it's not too far away. Okay, it's about 2 weeks away. We scroll way down past the other CT assignment. This is CT2 and diabetes or Alzheimer's disease. Okay, and so what we're going to get in here, we have two patients we want you to discuss. So, you know, you're going to be some type of a healthcare practitioner, all right? Maybe you're a doctor, you're an intern, and it asks you to address these issues. And within this, we want you to consider all these things right here, okay? How are Alzheimer's and diabetes diagnosed, okay? I'll tell you right now, okay? You just look it up, but Alzheimer's, there is no blood test for Alzheimer's, okay? There's no scan that is reliably used. Scans are used only for research. The only thing people do is a psychological test called the mini mental status exam. Just look it up and you'll find it out, okay? Just do a quick combined Google search. Diabetes, how is that diagnosed? Well, all has to do with the handling of your blood sugar, okay? So you can have a measure your resting blood glucose levels. There's another test called the glucose challenge test, and probably the most reliable test that is now used is called the hemoglobin A1C test, and it just looks at how much sugar has coated the hemoglobin molecule. That's the one that's in your blood. So it's the HbA1c. Okay, so we could do all kinds of searches and address these issues right here. Okay, how does diabetes cause atherosclerosis? Okay, so you just link that out. You would just go right here and just go diabetes causes oops, sorry, I can't oh, it's this. What do we get? Boom. Okay, so we get all these things right here. So very easily, here's how diabetes drives atherosclerosis. Whoa, awesome. Okay, simple. Okay, very simple. We would say diabetes and the HbA1c test. There it is. Okay, all kinds of stuff about that. What is HbA1c? Okay, so it's really not that hard. You just gotta look around and follow the directions. Okay, we're just asking you to follow the directions. This is going to be kind of an eye-opening CT assignment for you guys as well. Alrighty, so those are the 3 things this week. Okay, keeping communication. Julia is just an animal when it comes to responding back and forth with the emails, and we'll see you next time.